My name is Sophia. I'm from New Jersey. I'm a senior in high school, and I had a long journey with this, but around last January, I started to notice like weakness in my hands. And then I went to the doctor following that in March, and they originally thought I had like cubital tunnel syndrome, which is at your elbow. And so I started occupational therapy right away, and then nothing was really getting better. So then we thought we should do surgery, but I was started to get atrophy in like my thumb muscle. So they assumed it could be carpal tunnel. So in May, I got cubital and carpal tunnel surgery. And then following that surgery, I continued with OT, but nothing was really improving to what they'd like to see. So then I had a brachial plexus MRI in July to like see if there was anything that would come up. And they noticed the C7 transverse process was elongated and compressing my brachial plexus. So then following that, I was diagnosed with thoracic outlet syndrome. And then I had a few more tests. I had like another MRN, an MRN, an MRA, and an MRV, which is like for the arteries and veins. And I had another EMG and I think a CAT scan. And then I had surgery following that in October. And now I've been in OT and PT since, trying to regain all my function and strength. So I noticed weakness, and then I noticed tingling, and then there was a lot of pain, and then I noticed the atrophy, which is now spread to the like my entire hand kind of, but it's primarily my thumb muscle. Um, but yeah, those are my main symptoms, and then like shocks in my arm. But it started off as just like weakness and then kind of progressed from there. So yeah, I started with OT back in right after my first appointment, right before my carpal and cubital tunnel surgery to help keep my strength where it was at and try to build upon it. And even though my nerves weren't fully like working yet, it was still helpful to like talk to someone through what I was experiencing. And I think it's still helpful no matter what, because you're working the muscles and like doing exercises that you wouldn't normally do in a daily life. And then I continued with OT after that surgery and up until my October surgery. And then after that, I did OT and PT. And now I'm just doing OT. But I think it was very helpful to regain all my range of motion and rebuild my strength. But on the mental side of it, it's also nice to talk to someone and like they understand what you're going through because you don't meet with your doctor twice a week. So you kind of, any new symptoms, anything that you're like experiencing, you can talk to them about it. So that was very helpful. So I was actually referred from my original surgeon to the other like peripheral nerve upper extremity surgeon who I met with who diagnosed me with thoracic outlet syndrome. But without that referral, it probably would have been difficult because there's very few and far between surgeons that treat this. So it was very helpful to have the referral, but yeah, not a lot of doctors know about it. So it's definitely. Yeah, it was pretty difficult. It was hard to like open things, like spray a spray bottle, write, handwrite, draw, a lot of like, or even just daily tasks that you do without even realizing that like you're using your hands. Um, and it's also hard, like I'm always been very athletic and into sports and I do tennis and swim, so that was also difficult, especially tennis, gripping tennis racket. So kind of affects you in all areas, I guess, of life. Like my biggest piece of advice would be to find a specialist, like to the best of their ability, because it is very helpful to have someone that knows what they're talking about, that knows all about peripheral nerves and how to treat it, and if you need surgery and what to do about it. And I guess another piece of advice would just be to stay positive throughout it all, because it is such a long process and it's hard because when you're in pain, you notice weakness and it's like can be very difficult. So best to have a positive mindset. So I feel like that helps you heal better.